Hi, I'm Kelly Forshaw-Smith, Head Medical Trainer for the Finishing Touches Group and Director and Technician of Medicos London. And today we have...
Stefanie Toms.
Stephanie came into the industry in 2011 at the age of 37. For 10 years prior, she was an art teacher, a job that she loved very much. Unfortunately, the services she worked for was privatised, so she was made redundant in 2010. It was shortly followed by a life-changing experience that led her to take some time out. Her decision to become a PMU artist was a lifelong dream. In fact, she'd never actually heard of it. But after 6 months as a full-time mum and considering her next career move, she stumbled across an advert on Facebook on permanent makeup. She remembered saying to her husband then, "I think I'd be good at that." And boy, was she. She's located in Northamptonshire, Buckinghamshire, and has a new clinic opening soon in a town called Stony Stratford. She teaches advanced skills in eyeliner, lips, and powder brows. Stephanie's won Best UK PMU Artist in 2019 and Best UK Eyeliner Artist in 2020 in the PMU Circle Awards. She has also been judged for a handful of PMU awards as well. She has a man's eyeliner webinar that's also due out in January. And Stephanie's topic today is going to be eyeliner, micropigmentation, tips and tricks. So welcome, Stefanie.
Thank you, Kelly. Thanks for having me.
You're welcome. You're welcome. So obviously everybody must know who you are when it comes to eyeliner in particular. What is it about eyeliner that you like so much?
I think predominantly for me personally, it's the challenge. It's still a challenge for me. I think I spent many years doing brows, and it's not that I've fallen completely out of love with them, but I think you get to a stage in your career where you can do them with your eyes shut.
Yeah.
And for me, eyeliner is the one thing it still engages me. Does that make sense?
Yes, that does.
And it engages me. I still don't find it easy. And I just, eyes are beautiful, aren't they? They're just lovely. And, you know, someone very plain can come in and, you know, you can literally just transform their eye. And you can just be so creative with it. I absolutely love it. It's my favourite thing. And I could literally do it all day, every day. And I love that. Yeah. I love it.
Oh, well,
I get really excited.
Lovely, I must say. Your eyeliner work is definitely my favourite eyeliner work of all the technicians that I look in. And I do follow you. I'm a stalker.
You're a stalker. A Stefanie stalker.
How do you decide what type of style or what types of styles are there that you can do with eyeliner?
Okay, so I think firstly, when my clients come in, they've probably seen something that I've posted. So and that's where the negotiation starts, I think, because it's obviously not suitable for everybody. You know, certain styles aren't suitable for everybody. So I guess it's just negotiating then. You know, you're looking at your client's anatomy, what's going to work well with them, what's going to age well. You know, a lot of people want this sort of shaded liner, which is lovely, but it's not for everybody because I guess I don't want to put everyone into a box because you have to have skin that can take that, the actual technique, if that makes sense. And there's some skins that just because they're overly vascular, because I believe that all eyes are vascular, but maybe if they've got protruding veins, then you know, I could not do a shade on that sort of eyelid. And if they're, you know, if they've got mature skin and it's crepey and it's very delicate, then again, it's just not, I'm just not going to be able to do it without causing trauma, which will lead to migration. And so it's just sort of working out with your client and advising them. And I say I know a lot. I mean, I'm really strict, like, you know, because I have ladies come in and they'll say they want this long wing, and you know, if I can't physically fit it into what they've actually got, I'm not doing it.
Do you ever start midway through and then think, yeah, this isn't going to work, you're going to have to go for something else?
Yeah, do you know what? I think it's experience, isn't it? Because I think I'm you know, the more experience you have, it's a different eye, but you've seen it before. Does that make sense? Just the same with a brow and a lip. You know, you've sort of seen it before. Every now and again you get caught out. But yeah, I think I quite often, because I do challenge myself, so I do push boundaries and break rules, and I try and give people what they want. And if it's not working out midway and it gets to a point where the eye is traumatized and, you know, I'm going to massively compromise the heel, I will just say, look, this is not working out and I'm not going to do any more, because it gets to a stage, you know, sometimes where you've got a lot of bruising and redness and swelling, you don't even know what's in there.
Yeah, very true.
So I will stop and I'll say, look, I'm going to stop. You're not going to have the desired heel, and I apologize for that. But what we'll do is we'll see how this heals.
Yeah.
Come back, and then we'll do it, and we'll do it in the second sitting. And that always works fine.
Sorry, darling. How many sessions do you do?
2. I always do 2. Yeah. And to be honest, I don't, because I use a carbon-based pigment, I don't have to do a huge amount of touching up, especially through the lash line. But it's normally, they'll probably want the wing extending a little bit, because the way I sort of place the wing, even though on a photograph it looks a lot longer than actually is, it's a bit of a bit of a photography trick, really. They're never quite as long as that and dramatic as they look. But because they're so soft towards the outside, obviously that can fade.
Yeah.
And sometimes you can lose a bit of that pigment. So normally all I have to do is extend that a little bit, and I can pop a bit more shading on. And again, because you're shading on the eyelid part of the eye, that's where you get the swelling. So sometimes it can look like there is more there, and then they come back, and you will know, if you do an eyeliner, they shrink dramatically.
Yes,
I mean, they look so big and bold, and they come back and it's like they're all shriveled up. So you can be a bit more confident. But I always err on the side of caution. I think where my clientele, I don't get many that want drama. Yeah. I love it when they do, because it's like, yes, I can just go for it.
Free reign.
But most of my clients just want to be enhanced, that they don't want anything dramatic. And I think that's very much down to your demographic, isn't it? You know, or your demographic, you know, because I know a lot of makeup artists that, you know, do a lot of big, bold stuff. I don't really get asked that often. So that's why I love it when I do.
Are there any other types of limitations of why you can't do an eyeliner?
I think you can pretty much get an eyeliner into, I think you can pretty much get an eyeliner into anyone. It's just what eyeliner. Yeah. You know, you could get a really nice classic liner, I would suggest, in most people, and I could put a flick on most people as well. There is no reason why I couldn't do that.
I guess if your contraindications and everything's fine, then there's no reason why. And what are some of the reasons for maybe someone out there who's thinking of coming into doing eyeliner? What are some of the reasons, contraindications of why we can't do eyeliners?
Right, the main one for me would be the use of lash serums.
Okay.
Because I have a lot of ladies, and that's probably because my clinic sells them, so they all buy it from us, and it's like, well, can we have liner? No, you're going to have to lay off that for a few months.
You say a few months of stopping using serums.
Do you know what? And I only say this from personal experience. I've used lash serums for many years, and a friend of mine, Paula Fitzpatrick, we did like a swapsy. It was probably about 18 months ago now, and we basically swapped eyeliners with each other, and both of us had been using eyeliner, and I cannot tell you, it was mutilation. It was just, I don't even know if she could take a picture of my eye. I mean, they were just bruised, red, so painful. I can't even tell you, because it thins the skin on the eye so much. It was awful. You know, when you were laying there, and I just wanted to say, just get off my eye, just get off my eye. It was just so painful. And she was like, I think she had to get her bolt out in the end, and she was, I mean, drilling it into my eye because she just couldn't get it in. It's just awful. And so I'm really strict with that now, whereas I have had a few in the past that have slipped through the net. And
probably lie, don't they? Because they really want to get it done. So they're like, no,
I don't even know. And I think I've got a like an online consultation thing now, so it doesn't get missed, if that makes sense. But I have done it before, and the minute you put the needle in, it's just instant bruising.
Really?
Instant, and I mean like blue bruising. And blood, yeah, it's really. So I always say to people, if they want it doing, 3 months at a minimum, I say.
Okay.
Yeah, just because if they want, I mean, it's like everything, isn't it? There might be half of 50% might be okay, but you just don't know what you're going to get, and it's incredibly painful as well. It feels really
thin the skin then.
Bruised. Thins the skin, yeah.
Oh, that sounds nasty.
Yeah,
what about clients, when they come in and they've got ginormous lashes? Do you do people?
No, so lashes I asked to be removed.
Yeah.
Lashes I asked to be removed, and the reason for that is because I know some techs, every now and again, I have topped at like a bottom lash if they've got top lashes on. But I think what people don't realise about lash serums is, I mean, it is essentially, it's cyanacrylate. It's a chemical, and even when you've had it and it's dry, it releases a vapour. So if you're then opening the skin, even if these lashes have been put on beautifully and they're not touching the skin, you're breaking the skin, and you've got such a high risk then of getting some like an allergic reaction or sensitivity to that chemical. So I would never do it. So yes, lashes, no. And pregnancy and breastfeeding, just the same thing.
What about glaucoma?
Do you know what? I don't know if I've ever.
Because I know that glaucoma, that's what one of the lash serums that you can buy. Because one of my clients came to me. Yeah, that was it. And she was just like, oh, I was like, your eyelashes are unbelievable. She'd had chemo, and then she'd come back and her eyelashes were super long. And she was like, oh, I'm using this stuff.
Well, you can actually get, because it's Allergan that actually makes that.
Yeah.
And they actually do a cosmetic version. I think it's called Latisse or something like that. But the Revitalash Advance actually contains a very small amount of the same medication, which is why it's so good. So yes, it is that. I don't know if I've ever done it.
I had to log on and pretend I had glaucoma. I felt really bad. I was like, I don't know if we should be doing this.
I don't know if I've ever. I mean, that's not on my. That isn't actually on my consultation form, so I probably wouldn't even know, to be honest. So yeah, I am a boundary pusher, I'm not going to lie, and I break a lot of rules. So I am naughty, but that just comes with experience and confidence, doesn't it, in your own sort of technique and ability and stuff like that. So
once you've decided on the style that you're going to be doing for the patient, and then they come on in and you've decided on colour as well, how do you start your eyes? Like, are they sat upright? Are they back down? Do you draw on? How do you start them?
Yeah. Okay, so they come into me and basically lay down, take a picture. And then because I'm able to, most of my clients want some sort of flick or wing, just something to finish it off. And it's I never used to do this, but because I wasn't capable of doing it confidently. But I think now it just looks so pretty to end it, and it almost, you can do it so fine that it can just look like a little lash. Oh, excuse me a minute, I don't know what's happened there.
Someone's probably trying to call you.
No, it's oh, hang on, I've got a software update. There we are, I'm back. Sorry, I've lost my train of thought. Well, yes, so what I will do is look at where I'm going to place that line first and foremost. That's the first thing I do. So I do that laying down, then I get to them to sit up, because obviously once gravity takes effect, you just don't, you want it sort of going up a little bit, not down. And it's important because I implant that with carbon, so for me, it's permanent. It will shrink and fade, but there's an element of permanency to it. It's not like a brow or a lip even, where it's going to fade a lot over time. You've got this for a long time. So I just want to consider how that's going to age in like 5 years. So I just make sure that if they are having a little flip, that it's, you know, it's going up enough to allow for it to sort of settle over probably the next sort of 5 years, if that makes sense. And then I lay them back down. I normally do a little bit of like an outline, and then I put my anaesthetic straight over the top.
Okay.
And I leave that on for 20 minutes. Now I always work on the left hand eye first, and then I do the right. So I only numb the left hand one first, and then just as I've started the left one, I numb the right one, and that works out quite nicely.
How come you do that?
I actually don't know why I do. I do know why I do it. I mean, I think it's probably something that I picked up in a training, one of my many training courses that I've done over the years. But I tell you what's so great about it, you know, when I first started doing eyeliner, you know, eyes are very sensitive. The skin is so delicate, you know, it is the most sensitive area to tattoo. And so the method that I have a method for every single eyeliner that I do, and I never deviate it from it. You know, even if I'm showing someone, if someone comes to training, I show them that's exactly how I do it every time. And the reason I do that is because I only work on one eye at a time, instead of I only work on one part of the eye at a time, and I won't move on till I've finished. And by doing that, you are really minimizing the trauma you're causing. Because when I first started, you know, you do a bit on one eye, whack a load of secondary numb on it, do a bit on the other eye, whack a load of secondary numb, back forth, over the same skin, you know, and then you're putting all that secondary numb on, which basically tightens the skin like that, so it makes it even harder for your needle to get in, so you have to work it even more. And so the reason I do it is because you can basically get most of the eyeliner done without using any secondary numb. And so you're causing the least amount of trauma to the eye. You're minimizing then all those sort of contraindications, all those things that can go wrong with an eye. And then you get a better heal. So that's why I do it.
Very good. Oh wow, this is fascinating. I'm loving it. Do you start on the wing and then move in, or do you start in
always on the wing? I always start on the wing, and it's a very thin, almost like a scuffy scratch. It's a very, I can't even express how lightly I do this line. So it's not a harsh line at all, but I get that in first because then I can wipe everything off. Yeah. Because I use my client's anatomy, other than when I do one of these big wings, like a more of a Latino sort of liner. That's the only time I pre-draw the entire thing. But with any normal liner, classic eyelash enhancement shade, all I actually pre-draw is the little wing line, and then I can wipe everything off. And I know that's there. I haven't got to worry. It's there, and I can come back to it. So yes, always start on the wing line. Once that's in, I complete the lash line. I will not move on until I've completed the lash line. And then I will move on to the wing, and then I will move on to the shade if I'm doing a shaded, if that makes sense.
Wow, that's awesome.
I know. And doing it that way, again, you'll never go working over and over repeatedly. You know, once I've done that lash line, I don't go back. I don't need to touch it. I don't need to numb it. I don't need to do anything to it. It's done. It's finished. And so this is why when you look at my pictures, there's hardly any swelling. Like they say, how do you not get any swelling? It's because I'm not repeatedly going over it. But, you know, sometimes you have to be patient, Kelly. You know, I see this a lot with people that come in and train with me, you know, because I work very slowly. I have a strict method that I follow, and I work quite slowly, and you just have to have a huge amount of patience.
Yeah, no, absolutely. That's probably why I'm not very good at eyeliner. Everything has to be done in like quick.
I know. Yeah. You just want to get
you kind of etch it in first, your baseline, and then obviously you start to fill in the color. And you were saying that you obviously do it very do you have a certain angle that you like to work at?
Yes. So because I work with a single needle, so I used to use a shader needle, and I you know, I could probably do you know, I could do a normal sort of like a classic liner with a shader needle still. It's the issue is with a single, the good thing about a single needle is that you can get those lovely sharp points and stuff like that, and you can get those lovely fine shady bits. So yes, when you're working with a single needle and with a carbon, you are going to want to work as much as you can to sort of 90 degrees, 75 to 90. Yeah.
I thought you were going to say to put it on its side, but you're working at a 90 degree.
No, you actually can't. So with a shader needle, you can shovel it a little bit. You know, you're going to need the angle probably to work with. But when you're working with a carbon and a single, it would just be, I mean, you're going to get migration if you do that. So it's almost like injecting it into the skin.
Yeah.
So you're going to want to keep your needle, you'd work with the very, very, very tip of the needle, like the absolute tip. And it barely goes into the skin. I mean, just enough. You just feel it very, very slightly flicking in the skin. And just nice and slowly, always keeping your needle moving. And yes, sort of 75 to 90 degree angle. And you're absolutely
and do you
fine.
teach your trainees using a single as well, or do you?
I do. I don't. So I don't do beginners. I have thought about doing sort of teaching. That's one of my things that I keep meaning to get around to doing, but there's always so many things, isn't there?
Yeah.
I would like to do you know, maybe because there's a lot of techs that have just trained in brows, let's say, and they want to train in eyeliner. So I have thought about going and doing that and teaching them right from the very beginning. But still, they would have had experience.
Would you recommend them maybe to use, like, if you are going to be doing beginners or other beginners coming into the industry, maybe to use something that's, I don't know, an inorganic pigment, maybe because you want it to fade, maybe a bigger needle, because obviously
this is the thing. So this is the whole thing with pigments, because I'm using a single needle. The pigments that work best with that are the very fluid, a fluid carbon-based pigment. Okay, so with the device that I use most of the time, if I was to use a more of a thicker black, so still heavy carbon-based, I would struggle to work with that. I've tried, you know, I would struggle to use that sort of pigment with the machine and the device that I've got. So this is the thing. This is why I only do sort of masterclasses, because I guess I learned with a shader needle, and like most of us did. Yeah. So, and if you want to create the sort of eyeliners that I do, it's not physically possible to do that with a shader needle. It's just not. So they come to me to learn that specific technique. Now, if they want to go and still do their lash enhancement and just a normal liner without a flick with a 3 shader, absolutely fine, do it. But those sorts of pigments, it's like getting oil into water. That's how I liken it. It's really difficult.
What pigments are you using?
So my absolute favourite is an Italian one called Dermatech. I don't know if you're familiar with them.
Heard of it, yeah.
They're beautiful. I've just actually started using the lip pigments as well. So I use, I've got so many, I can't even tell you. I've got Fee, I've got Academy S one, I've got a couple of other Russian ones that I've bought along the way. I've got these Dermatech ones, obviously Permablend I've tried. The golden eye one, that's lovely. I've been using that quite a lot. That's nice there. Real Black's lovely.
Yeah, I've used that.
So I've got a handful, and it very much, I like the Dermatech. I could sort of use that on everyone, but there's pros and cons for different ones, and you just sort of work out, like the golden eye one, for instance, the Real Black one, that is a much softer heel. So it's going to be great, you know, if I've got someone that comes in that doesn't want huge amounts of drama, it's a lovely soft heel. Whereas if I want someone that wants something quite bold and black and staying there, I'm not going to use that. I'm going to use one of the Dermatech ones. There's a few of the black ones. The Fee Black, and Nightly Black it's called, is the absolute blackest I have ever used. That is my blackest black. Nightly Black. and it's a fee contour one.
Okay.
Yeah, that is by far, and I've got them all. I mean, I've just
Do you use colour eyeliners? Like, do you do different colours?
no. Do you know what? I've got to order. I have actually got a client that came in, and we just used. She wants a bit of purple, so I'm going to get some purple. But I don't get anyone that wants stuff like that, Kelly. But then I thought to myself, maybe I should order some in and have them sort of displayed.
Well, you could do. Well, thing is, it's probably because you're not. If you haven't done it,
I know.
Everyone all of a sudden, everyone's like, right, can I have this colour? Or maybe when they have their top up, they could do like just a little line above it.
I know. The thing is, though, Kelly, I think to myself, I will love doing that. How's it going to look in a few years?
Yeah, true.
And I'm very considerate of that, because they're going to be coming back to me then forever, and I'm going to be like, oh my,
did me.
What have I done?
Yeah, no, fair enough. So obviously we mentioned earlier when we got it done ourselves, it is a little bit sharp now and again. So do you, apart from just the primary anaesthetic, is there anything people can do that makes it less painful?
Yes, stretch. If you have a really, really tight stretch, honestly, you will spare your clients so much discomfort. And I even stretch when I'm wiping my clients, because if you stretch really firmly, and I mean really firm, I cause my clients bruises from stretching. That's how hard I stretch. Their eye does not move. It stays closed the entire duration of the treatment unless I ask them to open it. And I stretch when I wipe, and I wipe really firmly, and I just do 1, 2, 3 maximum wipes. That's it. Yes, so it's just this over wiping, not stretching, constantly moving, constantly having to, but you do need to learn that technique.
Yeah.
You can learn it for yourself, but to be shown that, I learned that with Will Anthony, literally one of the best courses I've ever done, actually. He was so firm and strict, and hold her, stretch her, don't worry about her discovery, like, oh my God, it was so good, because he was so hot on stretching and technique and of applying a liner. I learned so much from that. I can't even tell you. It literally complete game changer, that course for me.
I think that's the thing though, as well, is what you're saying is you must always keep training, shouldn't you? I mean, I know I do constantly with the medical. I do with the makeup side as well, but with medical in particular, because it's something I just want to make sure, even if I don't learn that much, at least it confirms that, right, okay, you're doing okay. Tick and move on for the next, but just constant, continual education.
I think when you've been doing it a long time, probably the amount you get from those courses, but you just pick up just 2 or 3 little nuggets, and they could be such small little things, but they can just completely change everything, can't they?
Absolutely.
Yeah, no, it is great. Yeah, it's great
to the pain thing. I mean, I don't know how true this is, but I always tell my patients, try not to have too much alcohol the night before, not too much caffeine, have something to eat before you come in. I don't know why, but it seems to be less painful. So,
well, it will be, yeah, definitely. I don't actually do any of that. You're so considerate, Kelly.
I've just been really nice. It's only because I'm crap at eyeliner. No, I'm joking.
Mine just get off the bed, low in blood sugar, like just about to pass out.
They'll be all right.
They'll be fine.
Maybe that's the method. Maybe you want them to pass out and then you can do their eyeliner. Oh, do you think the angle of the needle makes it less painful?
Yeah, I mean, I guess especially with a single needle, again, if you're going in, it's the dragging, isn't it? The depth, definitely. Excuse me, I'm gonna have to cough. It's really the depth, and I think this is what's so lovely about working with a single needle, is you honestly only have to just make such a superficial contact with the skin. Whereas I think when you're using a shader, you do have to go a little bit deeper, and it's a little bit more aggressive, and so you will trauma the eye a little bit more. And that's why I love a single needle so much. But yes, if I went too deep, 100%.
I remember trying a single needle and just got really, really frustrated with it, because I was like, well, where is it? Like, and I was like, this is going to take forever. How long does it take you to do an eyeliner?
Right. Okay. So it does. I would say it 100% takes longer. You know, there's no getting away from it. It really does. It takes longer. And I've heard other artists, oh God, no, I couldn't be dealing with that. I can bang out an eyeliner in an hour, you know, with a shader needle. But for me, I guess I wouldn't get half the pleasure out of what I do if I didn't, because it's like a piece of art to me. When I literally create this piece of art, and I feel so full when I finish. Like I just love it. I get so, I mean, you know, I've even had clients who say to me, do you want to snog them? You can snog them if you want. I was like, oh my God, they're so good. Oh my God, they're just so gorgeous. And that satisfaction for me, I would rather it take a little bit longer, if that makes sense. So going back to your question, how long does it take? Yeah. Right, so for a normal lash enhancement, probably I could do a lash enhancement without any flick, just so I'd probably book out an hour for that. For a normal sort of like a classic liner, again with no flick, probably about an hour and a half. And then we're going into sort of like classic eyeliner with a little flick, would probably be about 2 hours. For one of my shaded liners, I always book out 2.5.
Wow.
And then for the big wings, I book out 3 hours, because they take forever.
Wow.
With a single needle, they take forever.
Jeez, that is dedication.
It is dedication, but do you know what I say to people? This is the thing. My top-ups are 45 minutes. So a lot of techs they're spending 2 hours on the main thing, and then they're getting them back in for another hour and a half.
Yeah, true.
So it's all swings and roundabouts. Like everything that I put in stays in. So my touch-up is so minimal.
That like the longer it took, well, for me anyway, when I'm having a treatment, I get a bit fidgety. And I'm like, right, I need to go and do this, and I need to do that. And that's what I found with my clients in general. I mean, I'm very, very quick at everything that I do, like talking everything in life. Yeah. So like my areolas take an hour to do a bilateral areola. Wow. But I am super, super quick when I work. So I have to change the speed. And obviously, like I said, everyone has their own techniques of what they like. For me, I think I would start to get quite fidgety if I was lying for more than an hour, lying half an hour. But I guess that's what they're signing up for.
That, because the actual tattooing part of, let's say, the shaded liner is probably only an hour and a half.
Okay.
But you know, you've got to do the pre-drawing, you've got to do the numbing, you know, you've got all that, and that takes time.
Yeah.
And I like to have a chat with my clients, Kelly, you know.
Oh, true. I'm just all right. Next.
You know, I know some of these techs are like machines, aren't they? You know, I get girls come to me and say, this is a really different experience, because, you know, when I had them done before, you know, the tech didn't talk to me, you know, they're just like it's like a conveyor belt. I don't want to work like that.
No, I don't like the conveyor belt either.
The joy of it, isn't it? Is sort of, you know, meeting new people and sharing.
It's like a therapy session when my clients come in. I'm like,
therapy. Debbie Clifford said to me recently, she said it's like yoga. And it actually is, isn't it? I love it. You just, you know, it is. It's like your yoga. It's the teaching bit that feels like the work. Yeah. Actually, in with clients is, I love it.
Well, that's the word, you know, when you say the word treatment, that's exactly what it is. It's a treatment. Yeah, it's a treat to yourself to have it done. Yeah. And I know that, for example, some mums, when I want to get away from my little ones, I couldn't wait to lie in the bed for 2.5 hours.
It's true.
That would be good. So in total, it takes you, for one of those really big, like Latino flicky ones, that can
3. I book out 3 hours, yeah. And that's the entire treatment time, so they'll be gone. And I'm really good with sticking within that. But yeah, I book out 3 hours, because they can take such a long time to do.
And then roughly how long, once they've had that done and the retouch done, how far away is the retouch?
I say anything from sort of, it really depends how my diary is, but sort of four to sort of 8 weeks. I'm pretty easygoing about it, if I'm honest.
Yeah.
I always have been about retouches. I sort of say a maximum of 3 months, but you know, I book them in at the end and they come back. And so yeah, anything from sort of 4 to 8 weeks, because I used to have at least 6 weeks. In fact, at one point, especially with a brow, I would say 8 weeks, because I used to cause so much trauma. They would come back to me and their skin would still be actively healing. And, you know, you put a needle into healing skin, it just bleeds, doesn't it? So, but now I think because I cause such little amounts of trauma, it's such a superficial thing. I could get them back. I could probably get them back in 2 weeks.
How long roughly does an eyeliner last when you've done somebody?
Right. So bearing in mind that I don't use carbons for all of it, but through the lash line I use a carbon, so a pure carbon, and you know, you pretty much got them forever, haven't you? Let's face it. I mean, they're like I said earlier, they're going to shrink. And they're going to fade a little bit. So I normally say clients probably need to come back every couple of years and have a bit of a colour boost. Yeah. But there's still so much of that pigment in, it hasn't just gone. However, I say this, and then I had a girl in just before, she was literally on my last day before Christmas. And she came in, Kelly, I couldn't even believe it. I thought she'd had me over. I had to go and double check that she'd been a client before, because I'd done this winged liner and all you could see, there was just a little bit left on the ends here, completely disappeared. I know. And I'm like, are you sure you've been to me before? You know, because I'm really crap. You know, when you see people like, I couldn't remember this girl. She'd got completely different colour hair, and it all came flooding back eventually. And she was like, yeah, I came to you in, you know, your other clinic and and I'm like, I can't believe I've done this eyeliner, because I can't believe it's disappeared. Oh. But there you go.
Why do you reckon it disappeared?
I have no idea, because some skins just break it down, don't they?
Yeah.
This is the thing. You can say on average, most of your clients, you know, you sort of know what to expect after a couple of years. And with an eyeliner, I would expect there to still be a lot of pigment there. It would have lost all its shape, and it would have shrunk and faded and gone like a bluey grey colour. But there's still going to be a lot there. Yeah. But there was nothing. I mean, it was just like, but you know, some people have, like, they're really great, aren't they? And their bodies break it down, and it was absolutely fine. It just really took me back, because this is not something that
there we go. So you've been doing it for all that time.
I know, every now and then
bamboozled.
You do. You do.
So if you could give anyone some tips who's thinking of doing eyeliner, what tips would you recommend for them to do for looking for, I don't know, a training company, or looking to get into doing it?
To looking at getting into it, oh God, that's a tricky one, isn't it? Go spend your money with somebody that is good at eyeliner, that does a lot of eyeliner, because you know, there's a lot of techs that are fantastic at brows and fantastic at lips, but just make sure, if you're going specifically for eyeliner training, make sure you're going for training with somebody who can do eyeliner and does a lot of eyeliner. Yes, that would be, you know, and yeah, that would, I mean, that's really all I could say, you know, is to look at their work. And because there's a lot of people doing training now, especially like beginners training, isn't there? And if you haven't, if you've done eyeliner, don't, you know, for many years I was always okay with eyeliner. I've never been scared of doing eyeliner, because a lot of techs are scared of it. I was never scared, so I always did it. I always had a go, and I never had an issue with retention and stuff like that. But I would never promise to do something that I wasn't capable of doing. And that's really down to your integrity, isn't it? Yeah, 100%. So if I had a client come to me, and I remember this, it's quite funny, because I look back now and I just think, God, I could have easily given this woman, but I remember her showing me a picture, and we're probably going back like probably 4 or 5 years ago, and she showed me this picture, and it was like it was like a little Latino sort of liner, but I just wasn't confident that I could give her it. And I said, I'm really sorry, I don't want to say that I can do it, because I can't, because I didn't want the stress of it, because she was quite particular. She knew what she wanted. I know it's ironic now, isn't it? But so I just, don't push yourself to beyond your capabilities. Yeah. You have to push yourself a little bit, because that's how you learn, but don't promise someone something, because I've seen some horrendous liners by text that I just, they're going downwards. And I even had someone come in the other day that said they'd had one and the tech had used green soap to clean their eye out.
Ow. To clean their eye out with.
To Kelly, you just think, wow, I can't. There's like a serious lack of common sense there, isn't there? Oh, woo, okay, that must have been really
as well. Is it? Nowadays, a lot of people, well, as far as I know, like I've trained people, and then literally a month later, they're opening up a training school, and I'm like, well, you haven't even seen how it's going to heal. Like of your first patients, like often, or done any case studies. How can you open up and then sell? Which I think is obviously very unfair for the people that are going in. Maybe they're kind of swayed by the price of it, which I don't think they should be swayed. They, like you said, look for somebody who's, you can see their work, and I just think
look at their work, because you will know this, Kelly, as well now. It's a lot of this is down, and a lot of the way you buy into stuff is down to branding. And there are some fantastic branded companies, but what they're delivering is absolute rubbish. So do you know what I mean? So it's
how it is.
It can look all shiny on the outside. You need to get in, have a little look, have a little dig, see what's there,
Oh, it's been absolutely wonderful chatting to you, and I hope maybe we can do it again sometime.
Yeah, lovely. Thank you so much.
Could you tell me about your webinar? You said that you've got a male webinar coming.
I have. Dear God, I tell you what, this has been. So I was supposed to be filming this literally the week we locked down. So this has been a long time coming, and then it's just like, well, when do I release it? When do I launch it? And I guess I've sort of hesitated a little bit. It's just finding the right time. But I think January is a good time. It looks like most of us are going to be in tier 4 for a little while.
So release it now and give us something to look and watch and learn.
But I'm actually incredibly proud of it. I don't normally say this about myself. Like, I'm really tough on myself, and nothing's ever good enough. I know a lot of girls. I speak to a lot of girls that like this, and just as you just try to be everything, don't you? And I think from the outside people think, God, you're winning at life, Steph. But I don't often celebrate it, and I don't often tell myself and give myself a pat on the back. But no, I've just gone through it over the last few days, actually, just to looking at it all. I'm really pleased with it. There's a couple of little bits where I thought, oh God, I should have said that, or I should have put that in. But I'm really, really pleased with it, and I think I've put in as much as I could possibly put in one day, because it takes forever. I mean, this eyeliner, it's this poor girl, and it's like a 6-hour eyeliner. You just don't even know, how does that even happen? I kept looking at Martin, he was like, this normally takes me 2 hours. We're like 3 hours in, and I've only done the first eye.
Oh, well, I can't wait to see it. I look forward to it. So how will we know when you launch it? Will you put it on some of the...
Well, you'll see it all, won't you? It'll be in the next few days that I start promoting it. And I'll just promote it for probably just a couple of weeks and then launch it. So I have a lot of followers like in the US and stuff like that. So so I'm fingers crossed it does really well. So I'm
sure it will. Stefanie, thank you so much for chatting with you, and hopefully we'll chat to you again soon, and I can't wait to watch your webinar.
Thank you.
Thanks so much. Take care. Bye.